Okay, a simple straightforward question. We have a elderly male presenting with ischemic stroke and he has been hospitalized for thrombolysis. That means he has presented within 4.5 hours of the onset of symptoms and there are no contraindications for it. Which of the following procedures should be avoided in this patient except? Okay. Should we place a central line? No, because the patient is subjected to thrombolysis. There is increased risk of bleeding from any major venous and arterial punctures. So don't go for central line placement. Don't preferably see whenever we do thrombolysis for a patient. Remember, don't even give the aspirin and clopidogrel after the thrombolysis. Right, 24 hours later, we do a repeat CT scan to see if there is any hemorrhagic transformation of the infarct, and if there is no hemorrhagic changes of the infarct, then we start the dual antiplatelet therapy. So till then, we generally do not give. Like patient presented within 4.5 hours to the emergency room, we got a CT done, shows no bleed, or there is some other earlier evidence of ischemia, but no bleed for sure, then we know it is an acute ischemic stroke. Patient is presented within 4.5 hours, no contraindications for thrombolysis. Then in that case, please do not give aspirin. Please do not give clopidogrel. You can give statins, no problem. But these two antiplatelets do not give. Give the thrombolytic agent. Repeat a CT after 24 hours. Till then, no aspirin, no clopidogrel. 24 hours later, if the CT is fine, there is no hemorrhagic transformation, that is where the first dose of aspirin should be given to these patients. Okay. So no other antithrombotic treatment should be given. True. Now, even urethral catheterization can increase the risk of hemorrhage or bleeding into the urethral injury and bleeding. So avoid doing that. Okay. The last thing, in case of worsening of neurological status, fasten the rate of infusion. Right. This also should not be done. This also should not be done. We cannot increase the rate of infusion if the patient starts worsening neurological features. Most likely, it is because of the hemorrhagic transformation. Okay, so now they're asking, should be avoided in this patient except, so I'm sticking to option D, though the statement doesn't make sense here. Okay, all of these are something which should not be done in a patient with the acute ischemic stroke who is going for thrombolysis. That's it from me here. Thank you.